Subscribe to my channel Medicine Guide. Weight loss. Type 2 diabetes. Insulin. Semaglutide. Ozempic. How Ozempic works for weight loss. Ozempic, semaglutide, is an injectable medication used to help control blood glucose, sugar, levels in adults with type 2 diabetes. It can also lower the risk of heart attack and stroke in people with type 2 diabetes and heart disease. Ozempic isn't approved for weight loss. But because of how it works, some people taking Ozempic lose weight as a side effect. If you don't have diabetes, taking Ozempic for weight loss is considered an off-label use. Wegovy, a higher-dose version of Ozempic, is approved to help people manage their weight. This includes adults and adolescents ages 12 and older who meet certain body mass index (BMI) criteria. Wegovy can be used by people with and without diabetes. Both Ozempic and Wegovy are intended to be taken long-term. If you're prescribed either one to lose weight, it's possible to have rebound weight gain after stopping it. Weight management is a complex challenge faced by many people across the U.S. Despite many efforts, traditional weight loss methods often fall short, leaving people searching for alternative solutions. But within the last few years, glucagon-like peptide-1 (GLP-1) agonists have emerged as a top contender for helping people lose weight. Ozempic, semaglutide, is a GLP-1 agonist approved to treat type 2 diabetes. It's not approved for weight loss, but people can lose weight as a side effect. Because of this, researchers studied Ozempic to see if it could help people without diabetes, too. In June 2021, the FDA approved Wegovy, a higher-dose version of Ozempic used specifically for weight loss. Prior to Wegovy's approval, Ozempic could be prescribed off-label for weight loss. Today, healthcare providers still continue this practice even with Wegovy on the market. If you've been prescribed Ozempic for weight loss, you may be wondering what to expect. We discuss what you should know ahead. Is Ozempic a type of insulin? No, Ozempic is not a type of insulin or a substitute for insulin. But it does stimulate your pancreas to release insulin when glucose is present, such as after a meal. Ozempic relies upon your body's own insulin to have this effect. So, it's not used when your pancreas can't make insulin, like in type 1 diabetes. How does Ozempic cause weight loss? GLP-1 agonists like Ozempic help to control your blood glucose levels, but people taking them also tend to lose weight. GLP-1 is the key hormone involved in this process. After you eat, cells in your intestines release GLP-1. This triggers insulin release and blocks glucose production. It also slows down how fast food leaves your stomach, making you feel full. GLP-1 is also thought to directly affect the appetite control area of your brain, as well as certain hunger hormones. By mimicking the effects of GLP-1, Ozempic can help curb your appetite and make you feel full so you consume fewer calories. This can result in weight loss. Keep in mind, medications like Ozempic and Wegovy should be paired with lifestyle changes, like a healthy diet and regular exercise, to get the most benefit. Is Ozempic safe for weight loss? Ozempic isn't technically a weight loss medication, but it's considered safe and effective for type 2 diabetes, and you may lose weight as a side effect of treatment. If you're prescribed Ozempic and you don't have diabetes, this is considered off-label use. Wegovy, on the other hand, has been found to be safe and effective for weight loss. It's approved for use in adults and children ages 12 and older who meet certain body mass index (BMI) criteria. Ozempic and Wegovy have many of the same risks, including pancreatitis, inflammation of the pancreas, gallbladder disease, and kidney damage. Animal studies have shown an increased risk of thyroid C-cell tumors with these medications, but this risk hasn't been confirmed in people. Because of this, you shouldn't take Ozempic or Wegovy if you have a personal or family history of certain types of thyroid cancer. What are the side effects of Ozempic? Especially when you're first getting started on Ozempic, you may experience digestion-related side effects. These side effects are also common after your dosage is increased. For most people, they get better over time. Common Ozempic side effects include nausea, vomiting, diarrhea, stomach pain, constipation. These same side effects were seen with Wegovy during clinical trials for weight loss. But since Wegovy doses are higher than Ozempic, side effects may be more likely with Wegovy. Your healthcare provider can help you weigh the pros and cons of starting a medication like Ozempic or Wegovy. Keep in mind that both are intended to be taken long-term. Disclaimer: Channel's intention is to make sure that its consumers get information that is accurate, reviewed by an expert and error-free. However, the information mentioned here should not be used as a replacement for the advice of a qualified physician. The information given here is for informational purposes only. Consult your doctor and discuss your queries related to any medicine or disease. Thank you for watching the video. Please subscribe to my channel Medicine Guide.